Hi everyone! This is the second staff training video on policies and procedures at Anew. This video will cover emergency procedures, infection control and bloodborne pathogens, and professional boundaries and ethics. Let's get started. This section will cover emergency procedures briefly and highlight the most important things to remember. So for CPR and first aid, any staff member trained can perform these measures to help clients until medical professionals arrive. Any scenario that needs life-saving measures, 911 must be called. In the case that a client dies, first and foremost, call 911. Then the CEO, Director of Business Operations, and Director of Clinical Services should be notified. Staff will report facts surrounding the death to the best of their ability. In the case of serious illness or injury, staff may call 911. When injuries occur at Anew, an incident report must be filed. In the case of COVID-19 or other pandemics, Anew follows guidelines outlined by the Center for Disease Control and what the State of Minnesota Department of Health mandates. If there is a fire, everyone must leave the building through the nearest accessible fire exit, and all people present will meet in front of the building at door 55 on the opposite side of the parking lot in the grass. The lead safety staff will make sure all clients and staff are accounted for. Anew has a fire monitoring panel across from the fishbowl. In addition, Anew has automatically closing fire doors, a sprinkler system, fire extinguishers, and fire alarm poles at every fire exit, which there are 4 total. Fire drills are done every quarter. So, during a power outage, emergency lighting will kick in. Lead clients to the dining room and contact on-call if applicable to determine a plan. You can contact Xcel Energy or Backmeyer's facility manager to get updates. So in the case of a tornado, staff and clients will make their way to the dining room. Staff will take roll call to ensure that all clients and staff present that day are safe. In the case of a blizzard, all clients will be expected to remain on site. Staffing may differ depending on how safely they can get to work. Staff already present may need to stay longer than their posted shift. So in the case of a chemical spill, first you will communicate the hazard to others in the area. Call 911 if the situation necessitates it. Second, you will control the spill, so put on personal protective equipment such as gloves and goggles and focus on making sure the spill does not become worse. Third, you will contain the hazard, and lastly, you will clean up the spill and clean all impacted surfaces. During an active shooting, staff and clients should follow these steps. Run and get out of the building. Call 911 when you are safe to do so. If you are unable to leave the building, find a place to hide. The best places to hide are areas with thicker walls, fewer windows, and rooms that can be locked. Turn off lights in the room, put heavy furniture in front of the door, and remain as quiet as possible. Stay in place until given the all clear by law enforcement. If running or hiding is not an option, a last resort is to fight. However, you are not required to do this, as this can be very scary. When administering Narcan, use the following steps. Look for signs of a possible overdose and check the client for responses. Not responding, irregular breathing, and small pinpoint pupils are signs of an overdose. If these signs are present, call 911. Administer the Narcan spray. Do this by tilting the client's head back and put the tip of the nozzle into either nostril. Press the plunger to administer the Narcan spray. If the Narcan is an injection, fill the syringe and inject into the thigh, and this can be injected through clothes if need be. Then put the client on their side and watch closely. If they continue to be unresponsive and or breathing is irregular, give another dose. Make sure to have at least 2 doses of Narcan in your fanny pack. While this section is going to focus on HIV, the precautions staff can take to reduce the risk of contracting an infection can also help lower the risk of contracting other diseases. So, normal modes of transmission for HIV include sexual contact, using contaminated needles, and HIV can be transmitted to a child during pregnancy and delivery, according to the World Health Organization. Risk factors for contracting HIV include unprotected sex, and sharing needles. For those with substance use disorders, the risk is higher due to a higher risk of engaging in unsafe behaviors. So the probability of infection is higher in those with substance use disorders. Both injection and non-injection drug use can lead to a higher likelihood of developing HIV. This is because harmful use of substances in the context of sexual behavior, along with sharing needles, can cause someone to become infected with HIV. Promoting safe sex practices among clients, as Anew does by having condoms and other contraceptives available, greatly reduces the risk of being exposed to and contracting HIV. According to the Center for Disease Control, the risk of contracting HIV at work is very small, even if you come into contact with bodily fluids or use needles. However, a risk is still present, and staff should adhere to safety precautions when dealing with bodily fluids and disposing of sharps. When dealing with bodily fluids, staff should wear gloves and goggles, if available, to make sure fluids do not come into contact with skin or eyes. After dealing with the bodily fluids, staff should wipe down contaminated surfaces and thoroughly wash their hands. When dealing with sharps, staff should wear gloves and dispose of sharps in designated sharp containers. When at the med window, staff should have the sharps container available for clients to dispose of needles themselves so staff do not have to touch the sharps. These small precautions can reduce the risk of bloodborne pathogens greatly. Maintaining professional boundaries is important for both the safety of employees and clients. It is unethical for an employee to engage in a relationship with a client and/or engage in inappropriate behavior. Employees are not permitted to give money to clients or gifts. The University of Minnesota defines boundaries as the foundational rules, norms, expectation, limits, and roles that create and maintain the therapeutic relationship. In addition, employees must treat all clients equally and make sure that professional boundaries are never crossed. Clients in residential treatment facilities are considered vulnerable adults. Ensuring that they are treated ethically is very important. The Ohio Substance Use Disorder Center of Excellence highlights the importance of boundaries and ethical dilemmas that you may encounter. Boundaries are important when providing care to clients to protect the therapeutic process, protect patients from exploitation, and to protect providers and staff from liability. Boundary issues can be caused by an inability to differentiate between a professional and personal relationship with clients. There are consequences for both staff and clients. Staff may experience burnout and compassion fatigue, lose their job, or in extreme cases face legal problems. Clients may leave treatment, face depression, and find themselves mistrusting providers. The best way to ensure boundaries are being maintained is through self-care, continuing education, like staff training, supervision, and consultation. There are many ethical dilemmas you may encounter in the workplace. Here are a few listed and why the dilemma can exist. So in terms of informed consent, you will help make sure clients are fully aware of any risks of treatment and how Anew addresses risks. Clients have the right at any point to rescind releases of information and leave treatment. While you should encourage continued participation in the program, the choice is ultimately left up to the client. So, for confidentiality, staff must make sure they do not tell important personal and health information to people outside of the Anew program unless consent has been given by the client. This helps create a safe environment for clients. So, for giving and receiving gifts, it is best practice to not give or receive gifts from clients. However, sometimes there are cultural considerations that must be taken into account. You can reach out to administrative staff if you feel you need more information and direction on what to do. So, while your personal beliefs are important, balancing professional and personal beliefs is important to maintaining a professional environment. You can do this by recognizing how your values, beliefs, and biases influence your work and ensuring that you treat clients with respect. It is best practice to not add, friend, follow, or accept current or past clients on social media. Personal versus professional social media accounts should be clearly distinguished. You should also be aware of your privacy settings. Some key takeaways from this portion of the staff training are: be knowledgeable of emergency procedures. Being aware can save lives. Contracting HIV and other bloodborne pathogens is uncommon in the workplace. However, you should still follow precautions to further lower your risk of contracting an illness. Lastly, maintaining a professional relationship with clients is important for both staff members and clients. Alright, and these are the references I used to create this portion of the staff training. Thank you so much for watching.